In an ideal world, every newly delivered mother and baby would benefit from a postnatal checkup from a paediatric osteopath to ensure that the effects of labour, delivery and birth don't go unresolved. Lauren Stevens decided to bring 6-day-old Lola to the Osteopathic Centre for Children so that both she and her baby could be treated.
Yeah, I mean, a lot of it is just really helping her body adapt to the changes of having given birth, because it's actually one of the hardest things that most of us will ever do. And it's, for some women, it can be almost like running a marathon. I mean, it can be a huge, long process. And part of what we want to help her to do is to help the pelvis to settle back down into its pre-pregnancy position, to help the internal organs settle back down to their position. Things gradually change and normalise anyway, and the body's very well designed to do that. But if you've had a very long labour or a very difficult labour, the body doesn't always do that quite as easily. So that's one of the things that we can do.
It isn't uncommon for women to experience problems after birth, from low back pain to headaches, stress incontinence to pain during intercourse, all of which can be addressed that much more easily shortly after the birth. Lauren's baby needed an assisted delivery using Ventouse, and that's left her head slightly tender and misshapen.
Sometimes, well, what we're looking at is the skull is almost like a membranous bag at this point in time. That it's got bony stiffeners in it, but it isn't the sort of elaspoioric variety of skull that we associate with what a skull looks like. So it's actually much more fluid and much more membranous. So when you apply a Ventouse, the Ventouse obviously compresses, and you put a lot of pressure on to then pull out, and that can compress some of the structure that we call the tentorium, and underneath the tentorium and around the tentorium there are vascular sinuses. So they can actually get a bit of a headache from that compression and that congestion, as well as obviously having a bruise, some of them, from the Ventouse.
Kate Hammer was helped through a difficult pregnancy by the OCC when she suffered from preeclampsia, a condition affecting 1 in 10 pregnant women, where they develop high blood pressure together with protein in the urine. The ante- and postnatal care offered by the centre for her and her baby Audrey have helped them throughout.
I had preeclampsia, so from week 28 I was actually quite ill, and I really relied on the treatments that I was getting and just the support and caring I was getting here. And the day before Audrey decided to come 4 weeks early, I was treated, and Luciana, the osteopath, said this baby's ready to come out, which was very reassuring when I found myself at the hospital the next evening and it was all happening.
Audrey, who is now 13 months, was born 4 weeks early and stayed in hospital for a month. She's now back on track, but needs some treatment for mobility.
When we look at children, we look at how the hips internally or externally rotate. So we've been looking at that with Audrey and helping that one that tends to turn in to release back out. And then we've also been working on the spine, on the muscles of locomotion, and on sort of higher up during the spine, which is where you do your walking from.